Good morning and welcome to Radio Friends on Tuesday, September the 11th. I want to introduce you to Dr. Syed Shah. Good to have you here, Doctor, from MU Healthcare. It's first time with us on Radio Friends.
Yes, sir. Thanks for having me.
And we want to deal with Parkinson's disease. How many people in our country are affected by Parkinson's disease?
So till this time, there are about 1 million people with Parkinson's disease.
1 million people?
That's correct. And around the world, there are 3 million people in 1990, which increased in 25 years to 6 million. So there are approximately 6 million people. And the estimates are that it would double in next 25 years to 13 million.
What causes Parkinson's disease?
So that's a very good question. The exact etiology is not known, but we know where exactly the problem lies. It is in the specific part of brain called basal ganglia. And in basal ganglia, there is a specific area which is affected, as substantia nigra, which releases the chemical called dopamine. So when that chemical is missing, the circuits which control movements, behavior, emotions, those are affected.
So it's almost like it's a short circuit there, right?
There's a good way to put in, because there are islands in brain which talk to each other. And those circuits between those islands, just like pipelines, if there is any abnormalities in those circuits, then people develop tremor, stiffness, slowness of movement, and a lot of other non-motor features.
Is there a cure on the horizon?
So far, we do not have any cure at this moment, but there have been a lot of research is going on, and Parkinson's disease is a livable and treatable condition. In clinic, we are seeing patients with the disease for 10 years, 20 years, 30 years, even 40 years. So we call it PD10.
So Parkinson's disease will not kill you.
That's correct. Alan Alda was recently diagnosed with the disease, and he's also of the opinion that it is a livable and treatable condition. He has a podcast, and he's working, so it's quite a livable.
When you say treatable, does that mean that you can perhaps turn back the effects of Parkinson's disease? Maybe not get rid of it totally, but you can reduce some of those symptoms.
That's correct. So if you have, let's say, if you have tremor, we have medication for that. Stiffness, slowness of movement, then a lot of non-motor features, constipation, mood problem, memory problem, and not only medication are there, but therapies, different therapies like physical therapies, occupational therapies, speech therapies are there, and a lot of other behavior therapies are out there.
We're just about out of time, but are there any early warning signs before you actually feel the effects of it? Is there anything you look out for?
There's again a very good question. For things that we are calling it prodromal features, it appears before the motor symptoms like tremors, stiffness, slowness, and those are loss of sense of smell, constipation, mood problem, and what we call REM behavior disorder. That is when people act out their dreams.
Okay. But now let's caution, just because you have one of those symptoms does not mean that you have Parkinson's
Exactly.
disease. If you want more information, the best thing to do is to go on the website, MU Healthcare, and you can get more information. Dr. Shah, thank you so much for coming by.
Thanks for having me.
Very interesting visiting with you.
Thanks for having me.
Have a good day.
You too.